the most bizarre medical treatments people actually used. Imagine you're lying on a doctor's table in 1799, and your physician cheerfully informs you that he's going to drill a hole in your skull to let the demons out. Or maybe it's 1920, and your psychiatrist prescribes you cocaine for your depression. Legally, by the way. Today, we're diving into the most bizarre medical treatments that real doctors actually prescribed to real patients. And here's the kicker. Some of these were considered cutting-edge science at the time. Let's get into it. 1. Trepanation. Drilling holes in your head. The treatment. Cutting holes into someone's skull while they're still alive. The year is 3000 BCE, and you're living in ancient Peru with terrible headaches. The local healer decides evil spirits have taken up residence in your cranium. The solution? They need an exit route, so they lay you down, give you some fermented beverage, and proceed to scrape a hole right through your skull bone using stone tools, flint, obsidian, volcanic glass. The process takes hours. You're awake for most of it. Here's the insane part. Many patients survived. We found ancient skulls with multiple trepanation holes showing signs of healing. Some skulls have 3, 4, even 5 holes drilled at different times. The survival rate for Incan trepanation was around 75–83%. Honestly impressive considering they had stone tools and zero understanding of germ theory. Did it work? For skull fractures or blood clots pressing on the brain, trepanation could actually relieve pressure and save lives. The ancient surgeons noticed some head injuries improved after trepanation and thought, let's try this on everyone. Classic correlation versus causation. The practice continued into the Renaissance. In the 1500s, European doctors were still trepanning patients for epilepsy, mental illness, and migraines. And get this, some people still advocate for trepanation today, claiming it enhances consciousness. A British woman even filmed herself doing it in 1970 and ran for Parliament on a platform of legalizing voluntary trepanation. She lost. 2. Mercury, the miracle cure that killed you. The treatment, consuming, inhaling, or rubbing mercury all over your body to cure basically everything. Mercury looks magical. It's a shiny, silver liquid metal that forms perfect little spheres. It's also incredibly toxic. But for over 2,500 years, doctors prescribed it for everything from syphilis to constipation. Mercury really had its heyday during the syphilis epidemic starting in the 1490s. Doctors developed the salivation treatment, coating patients in mercury ointment and sealing them in hot rooms for weeks. The goal was to make patients produce up to 3 pints of saliva per day to purge the disease. In reality, excessive salivation is mercury poisoning. Imagine you're a syphilis patient in 1530. Your doctor covers you in gray mercury paste, wraps you in blankets, and locks you in a hot room. Over the next few weeks, your teeth fall out, your gums rot, you drool so much you need a bucket. Your hands shake uncontrollably. But hey, some of your syphilis sores are clearing up. They're coming back. There was a popular saying, a night with Venus, a lifetime with Mercury. Here's the kicker. Mercury doesn't cure syphilis. It might temporarily suppress symptoms by poisoning the bacteria along with the patient, but the disease always came back. The actual cure, penicillin, wasn't discovered until 1928. By that point, mercury had been the standard treatment for over 400 years. Doctors also prescribed mercury for depression, tuberculosis, and female hysteria. Abraham Lincoln reportedly took mercury pills for depression, which might explain some of his health problems. 3. Heroin for your cough. The treatment, giving patients heroin to suppress coughs and treat respiratory issues. In 1898, Bayer Pharmaceutical Company, yes, the same Bayer that makes aspirin, introduced a new wonder drug called heroin. The marketing was incredible. The sedative for coughs, non-addictive morphine substitute, safe for children and adults. The year is 1899, and you've got a persistent cough. You walk into your pharmacy, and the pharmacist recommends Bayer's new heroin tablets. So you buy a bottle, and holy crap, it works. Your cough disappears. You feel amazing. In fact, you feel so good that you keep taking it, and then you realize you can't stop because you're experiencing withdrawal. Congratulations. You're addicted to heroin prescribed by your doctor. They marketed this stuff to children. There were advertisements showing mothers giving heroin cough syrup to their kids. Mrs. Winslow's soothing syrup contained morphine and was marketed for teething babies. Cocaine was everywhere too. Sigmund Freud was a huge fan and prescribed it for depression and anxiety. Coca-Cola originally contained actual cocaine, about 9 milligrams per glass. The advertising slogan was, "Coca-Cola revives and sustains." Yeah, cocaine will do that. The heroin party ended around 1914 when the Harrison Narcotics Tax Act required prescriptions for opiates and cocaine. Bayer stopped marketing heroin in 1913 after realizing that, oops, it's super addictive and people are dying. The legacy. This is why we have the FDA today. Well, actually, something similar happened with OxyContin in the 1990s. So apparently, we didn't learn our lesson. 4. Bloodletting. The treatment that wouldn't die. The treatment, cutting open patients' veins to drain their blood, because obviously, having less blood makes you healthier. Bloodletting was used for over 3,000 years and prescribed for every ailment imaginable. Fever, bloodletting, headache, bloodletting, broken leg, bloodletting. The logic was based on the ancient Greek theory of the 4 humors: blood, phlegm, yellow bile, and black bile. Illness was supposedly caused by an imbalance, and the cure was to remove the excess. Since blood was easiest to access, doctors went to town on people's veins. It's 1750, and you wake up with a fever. The doctor pulls out a lancet and makes an incision in your arm. He might remove a pint or more of blood. Now you're not just sick, you're sick and anemic. Your body's fighting an infection while trying to replace all the blood you just lost. If the doctor doesn't want to get his hands bloody, he might use leeches instead. In the 1830s, France imported over 40 million leeches per year for medical use. George Washington is probably the most famous bloodletting victim. In 1799, he developed a throat infection. His doctors drained about 40% of his blood volume, roughly 5 pints, over a few hours. Washington died the next day. The bloodletting likely killed him. Bloodletting doesn't work for the vast majority of conditions. It usually makes things worse. But some patients got better after bloodletting, not because of it, but despite it. Doctors saw recoveries and thought, success. The practice declined in the mid-1800s when doctors began using actual scientific methods. But even after evidence showed bloodletting patients had higher mortality rates, many doctors continued because it's what they'd always done. 5. Lobotomy. Let's just scramble your brain. The treatment, destroying brain tissue to cure mental illness. The lobotomy earned its creator, Antonio Egas Moniz, the Nobel Prize in Medicine in 1949. A procedure that involved destroying people's brain tissue with ice picks won a Nobel Prize. Developed in the 1930s, The lobotomy was a treatment for severe mental illness. Psychiatric hospitals were overcrowded, and doctors were desperate. Moniz got the idea after seeing that removing the frontal lobes of aggressive chimpanzees made them calmer. He thought, why not try that on humans? Then Walter Freeman took it mainstream with the transorbital lobotomy, the ice pick lobotomy. Freeman would insert an ice pick-like instrument through the eye socket, tap it through the thin bone with a hammer, and sweep it back and forth to sever connections in the frontal lobe. The whole procedure took about 10 minutes. Freeman performed it in his office, in hotel rooms, even in the back of his van, which he called his lobotomobile. He performed this surgery on over 3,000 people, including children as young as 12. It's 1950, and your teenage daughter is diagnosed with depression. Walter Freeman uses electroshock to knock her unconscious, lifts her eyelid, inserts an ice pick above her eyeball, hammers it through the bone, and wiggles it in her brain. 10 minutes later, your daughter wakes up with 2 black eyes and will never be quite the same person again. This happened to Rosemary Kennedy, JFK's sister. At age 23, she received a lobotomy that went wrong, leaving her severely disabled for life. Between 1936 and the late 1950s, an estimated 40,000 to 50,000 people in the United States received lobotomies, many without their consent. Women made up a disproportionate number of patients. The mortality rate was about 5%. Survivors ranged from slight personality changes to complete mental incapacitation. The lobotomy era ended in the 1950s and 60s when new psychiatric medications became available. But tens of thousands had undergone irreversible brain surgery. Conclusion: from drilling holes in skulls to ice picks in eye sockets, from mercury smoothies to heroin cough syrup, our ancestors really thought they were doing their best. The scariest part? These were mainstream, respected treatments performed by licensed doctors who genuinely believed they were helping people. Which makes you wonder, what are we doing right now that people in 2225 will look back on and say, what the hell were they thinking? The lesson isn't that doctors are stupid. It's that medical knowledge evolves. We need evidence-based medicine, actual data, and the humility to admit when we're wrong. Thanks for watching. And remember, at least your doctor isn't trying to drill holes in your head or prescribe you heroin. Probably.